Namaste everyone. I am Dr. Vivek. I am a senior consultant practicing in vitreoretina services of Shekar Eye Hospital for the past 20 years. I am here to talk about a very common topic, or rather a more common question: is glaucoma common in diabetics? So many people equate glaucoma and diabetic retinopathy or diabetes related eye problems, but they are not the case. But to a certain extent, their question is valid because glaucoma is commoner in diabetics. Almost 40% of diabetics do have glaucoma, but they are not the same. I mean, diabetes doesn't cause glaucoma directly, but they are at a higher risk of developing glaucoma. So let us separate these two issues and learn about them. Glaucoma is an age-related eye disease like cataract, like age-related macular degeneration. Glaucoma is also an age-related disease, which typically means that you are at a higher risk, or all of us are at a higher risk beyond 40 years of age. So what happens here is that the pressure in the eye rises beyond a certain level, and that leads to continuous damage of the neurons or the nerves in the eye, leading to visual loss, which is mostly irreversible. So this can happen without diabetes as well. Non-diabetics also can develop glaucoma. But then what do we mean that 40% of diabetics develop glaucoma? It's not the same problem. The degeneration or the age-related loss of function of many organs can lead to glaucoma, and hence they are not directly causative, they are not directly related to each other, but they can have an association is what we call them. But then can diabetes per se cause glaucoma as well? Yes, definitely. As we know, diabetes leads to other complications in the eye. One of them is diabetic retinopathy, which can also cause glaucoma at a later stage. At a very advanced stage, there is something called as neovascular glaucoma, where the condition of the eye is really very advanced, very late. People tend to ignore or present very late, or sometimes because of some various other problems, the condition deteriorates rapidly, typically after some intervention, not because of the intervention that they have had, but because the disease progresses. And that is when they develop what is called as neovascular glaucoma, where the pressure, abnormal blood vessels develop in the front of the eye, leading to very high glaucoma, which is very difficult to manage. So there we'll have to press the pedal, and it's almost like an emergency or an urgency, where we need to act very quickly to even maintain a little bit of vision. Forget getting back whatever vision loss has happened. Even to maintain a little vision, to salvage the eye is a Herculean task. But it can be done with good diabetes control and regular follow-up. So these are the two separate issues, but they can come together, and there are so many other factors as well. See, like glaucoma patients need to use a lot of eye drops. Some of the eye drops can actually worsen the diabetic retinopathy. There is a small group of drugs called as prostaglandin analogs, which are very powerful, which can be used once a day, because of which it is prescribed quite commonly in glaucoma patients. But these drugs, these prostaglandin analogs, can actually worsen the diabetic retinopathy. So in a patient who has pre-existing diabetic retinopathy or a diabetic macular edema, we would rather prefer to not use this drug. So there are various ways and means in which these two diseases interact amongst them, but they are not directly associated with each one of them. I hope I have answered the question. If you still have any doubts regarding this, or any questions that you need to ask, you can definitely reach out to our website. We will be very happy to answer your queries.